healthcare leaders on very, very relevant topics today on how monitoring and early warning systems can actually save lives and how to actually implement them as well. But before we go ahead and before we move forward with today's program and before I declare everything open, we really want to present to all of you the spirit of Dozee. And for the first time in public, we've already seen a glimpse of it in the first of the day, but for the first time in public, the Dozee anthem. Can we have the Dozee anthem, please? He has also played a pivotal role in building the natural language understanding core stack for Google Assistant, enabling seamless voice.
So, Google Health has always been a cornerstone of what Google has been doing for several years now. And if we go by what I don't know, this is... In fact, Sundar's made always a big commitment to health. And that's been evident through all of the things that we've been doing to be able to deliver on this promise to provide tools to increase knowledge, success, health and happiness. Whether you look at the search product that we have and the partnerships, that we have some partnerships actually in India as well on what we call knowledge graphs, to actually give qualified subject matter level information to people who search for healthcare information, or with the content partnerships that we have on YouTube, we actually have specialized things. And today I thought I'll give you a little bit of a perspective on what we've been doing in the more recent years and what to look forward to. So we think about, and today is a Health AI Day, so it's probably appropriate to talk about this. There are really 5 AI advances in healthcare as we think about it. And those are areas where you have AI-based diagnosis. In fact, I have a video right at the end of this session of work that we're doing.
Last year, China shrank by 2 million people. Japan is shrinking by around 1 million people. Add to that Russia, Southeast Asia, which is not growing. For India, Tamil Nadu could start shrinking by 2035. The whole of the South has a fertility of 1.7, and fertility for Bengal and I think Punjab is about 1.6. In Punjab, of course, the boys want to go away to Canada or somewhere else. There is a challenge. And if you look at communities, the Jain community has a fertility of 1.2. In 50 years, I don't know whether there are going to be many Jains around. I'm going to ask all my big Jain, rich Jain friends to adopt some of us. Hopefully, we can get some good money. So this is a challenge around the world and it's happening for various reasons. The latest data says, globally, I think,
they are having one chronic condition or other, hypertension, diabetes, and so on. You're always, what would happen when you are not around, right? And exactly to address that, I am lucky. I am founder of Dozee. My parents are doing all right, and I'll share some very personal stories with you, right? That very recently when I was in US, had just minor cough and some fever. So something was definitely wrong. But what was really good was that I got to know about that, because generally parents would hide it. They won't tell anything is wrong. Immediately I booked some tests and all of that. Thankfully nothing was there. But that really brought us together as mother and son. That no matter where I am in the world, I am still there, and that really inspires the name of this product that you also saw, Dozee Shravan, right? You all know the story about what is the golden standard of being a good son at the end of it, or daughter, right? It is Shravan. We all know that story from Ramayana. It starts from there itself. And it is not just my story, by the way, right? As in Gaurav uses it for his parents. Samir, who is a very senior member in Dozee, the reason why he joined Dozee was actually that he was an NRI. He was in Tanzania, and his dad was a serious CKD patient. I'm saying was, because unfortunately we lost him in COVID. But he was a CKD patient, and for managing him, he was one of our first customers back in 2019 when he was using Dozee to manage it, and he came to me that hey, it's a beautiful product, and let's join forces to take it to the world. And that is how we started. Then, because of COVID, we shifted our focus towards the B2B market. We started going to the hospitals, and of course, we have done well. We are not just we have created the category; we are absolute and undisputed category leader in the remote patient monitoring space. But we thought that now that we are doing good, and we had a product, why not launch it? For taking care of parents for the world, right? And NRIs were such an important segment as a fabric in our society, right? Because they are our absolute flag bearers on a global stage. And when we talk about global stage, soft powers, and so on, right? They are really the flag bearers. So why not do something for them as well while they are doing so much for the country? So that's about it. What I had to share. So the service comprises of a contactless device which is designed for parent care, right? Why I'm saying that? Because parents generally don't like to use these all fancy gadgets and things like that, right? What they care about is, um, hey, I don't want to change my lifestyle at all. And those is exactly that. It goes under the mattress and without even touching them, monitors them. So no changes to their lifestyle, no changes to their the way they operate at all. Just go and go sleep on your bed like how you do always. And that's exactly what my parents are doing for 5 years, and it is working. So therefore, it is designed for parents. Alert, but what happens in case of alert? And now with the hospital network that Dozee has today, Dozee has capability to even manage and help our customers manage even in case of emergency as well. And that's exactly where I'm saying Dozee is a complete solution, a solution like no other came through so far. And very glad to launch it today. And we'll be launching it in some time. But any questions?